on me. So today that's what we're going to be demonstrating to you and explaining each step to you, okay? Okay, is there anyone out here in the audience that wants to be a volunteer so that I can show a sterile wound dressing? Is there anyone out there?
Me, please.
Oh, okay, sure. Come on in. Come on down. Okay, so we have a volunteer. Are you ready?
Yes.
Okay, so what I'm going to be doing is I'm going to go step by step, and I'm going to be explaining why we take so long in just changing a simple bandage. But this process is called a simple sterile wound dressing, okay?
Okay.
Okay, so I'm going to get you to go ahead and lay down. And what I'm going to do is I'm going to go step by step as far as getting the patient's name and verifying that I have the correct patient and why we have to verify so many times. Also, explaining how we keep our hands clean and there's no cross-contamination, okay? So, can anyone predict to me how we're going to stay sterile and not cause any contamination? Is there anyone out there? Can you predict how we're not going to have any cross-contamination?
Maybe clean your hands.
Yes, so cleaning your hands, that's one step. Also, what else? What else do we use so that we won't have any contamination?
Gloves.
Gloves, yes, and what else? It's one thing, another thing. Don't worry about it. I'll go through step by step and you guys will know by the end of this video. Okay guys, so the first step is reading the doctor's orders. We want to make sure that we're reading the doctor's orders so that we know what the procedure that needs to be done to the patient. We also want to make sure that we have the correct patient as well. We verify the patient's name, we verify the date of birth, and also the ID number. And we do all this by the doctor's orders and also the card, and we're verifying it by the patient's arm wrist. So all that information is on there. So first we go ahead and enter the patient's room. So give it a knock. Hello, my name is Kamisha. I'm your medical technologist for today. How are you?
Amazing. How are you?
Great. So the patient is saying she's amazing. She's doing pretty good. At the same time, we're also sanitizing our hands to make sure that before we touch the patient or the bed or anything, that everything is sanitized and clean. Okay, great. So let's first verify your name and date of birth for me, please.
Yes. My name is Chloe Bozeman. I was born in February 17, 2011.
Great, thank you so much. So let's go ahead and verify this on your wrist. Let's see your wristband. Okay, so the wrist states that we have Chloe Bozeman, date of birth February 17, 2011, and the ID number is still the same. It's 12345. Thank you. So now that I have the patient verified, I can now go ahead and explain what I'm here for. So, Miss Chloe, I'm here to do a sterile wound dressing on you today, okay? The doctor has ordered that for you, okay? Okay. Now, because we're doing a sterile wound dressing, I need to go ahead and ask the patient, do you have any allergies? Just to make sure that the tape and the latex does not cause any type of allergic reaction to the wound. Okay, Miss Chloe, do you have any allergic reactions to latex or tape?
No, not that I think of.
Okay, great. So now that we know that, we could go ahead and start the process. So, Miss Chloe, what is your pain level today on a scale of 0 to 10?
It will be about a 1.
About a 1. Okay, great. So now I know that the patient is not in pain and that we can go ahead and probably have a successful sterile wound dressing. So now I'm going to raise the bed up to my waist length so that it's easier to change the wound. Okay, so I'm raising the bed. Okay, and then I'm going to be bringing the rail down so that it's easy for me to get to the wound and make that change. Okay. Now I have my sterile gloves here, and so I'm opening my gloves, but you have to make sure that the gloves are on a straight table and that you're carefully opening the gloves, making sure that you're not cross-contaminating everything. Because we don't have a table right now, we're just gonna go ahead and kind of like show you guys how it's done. Let's turn it around here. Okay. I'm placing the gloves on, but I am making sure that I'm not touching the outside of the glove because we don't want any type of contamination to the sterile glove, okay? So I can touch the glove with this hand because it's already protected. So then I just go ahead and slide my hands inside. And I can fix it with this hand because it's already covered. Okay, so now we have the glove on. Now I'm going to be, if we were at the hospital, I would be bringing the blanket down and letting the gown up, stopping only where the womb is because we want to ensure privacy to the patient as well. Okay, then I'll be removing the bandage that's already on the patient. And when I remove the bandage, I want to make sure that the patient is healing well, okay? So I'm checking the bandage and I'm looking at the blood that's on the bandage. I'm making sure that the color is accurate enough. I'm making sure the drainage amount is okay. And I'm also making sure that there's not like any odor to the bandage as well. And we assess that to make sure that there's no infection. Then I go ahead to look at the wound and I'm checking the skin, make sure there's no skin breakdown. I'm also checking that the staples and the sterile strips and the sutures are okay. Then I look at the actual wound, and on the wound, again, I'm checking that there's no odor and the redness of it, and just making sure that everything is healing properly for the patient. Okay, and then I'm still gonna ask the patient, how are you feeling? Are you in any pain? Is this causing any pain?
No, this is not causing any type of pain. I feel just fine.
Okay, great. So now I can trash the bandage. Make sure, because this is a bandage with blood, we're gonna dispose the bandage in a biohazard trash can, okay? So I'm gonna pretend like I have my biohazard trash can and I'll be throwing it in the trash. You can't put a bandage away in a regular trash. Make sure we're using a biohazard trash can, okay? It could be a trash can or a trash bag, okay? So now that I'm done with this, it's time for me to go ahead and use a gauze to place it on her and give her another bandage, a fresh one. If I had all my materials, I would be disposing of these gloves, cleaning my hands, and carefully opening the package and placing it on her, okay? So we're gonna pretend that I did that step, and I'm gonna go ahead and open up the gauze, okay? Again, when opening up your materials, you want to make sure that you're on a flat surface. Always stay on a flat surface and never touch the gauze or anything, the bandage that's going to be used to cover the wound, because you don't want to contaminate it. Make sure when you do touch it, you have your sterile gloves on. Okay, so I have my gauze and I also have my tape that's going to be taped down. Now on the tape, we would write our initials, we would write today's date, and we would also write the time. And as medical workers, the time that we use is always in military time, okay? And we do this on the tape so that the next person that comes in with the next shift, they'll understand and they'll know who did this last bandage dressing, just in case anything went wrong, what time it was done, and the date that it was done as well. So when we add the gauze on, you want to make sure that you don't just add it here and pressing down. No, you want to, when you add the gauze, you want to make sure you kind of like just lay it there. And there's no position it or anything, because you do not want to irritate the wound. Again, we're going to pretend that it's already labeled. And we're going to add this onto the patient. Okay. And now that is done and complete. So we're going to cover her back up with pull her gown down, pull the cover back up. Always remember to give the patient the call light and state to the patient, "Hey, hello, here's the call light. And just give us a call if you need anything, or if you get in any pain, hit the light and let us know, okay?" Okay. Always ask the patient before leaving. Again, what's your pain level on a scale of 0 to 10?
Still a 1.
Okay, so it's still at a 1. The patient is not in any pain from the dressing. Always let the bed back down. And always let the rail up so that the patient does not roll out of the bed or anything. You want to keep the patient safe. When you dispose of the gloves, you use the glove here, this way, and here, this way. And you dispose it. And you can dispose this in the regular trash can, because there's no blood or anything on there. And also, when you are leaving the patient's room, you want to make sure that you clean your hands. Thank you. So, one of the main key words in this procedure is sterile. We want to make sure that everything is sterile with the patient, because you don't want to cause any infections, or you don't want to contaminate anything with the patient as far as yourself. So we do the cleaning hands, we do the wearing the disposable gloves, and also the sterile gloves. We do those things so that we protect ourselves and also the patient.